Dr. Mads Gilbert is an emergency medicine doctor who's provided healthcare for over 30 years in Gaza and is also an expert on hypothermia. He joins us now from Norway. Good to have you with us. So let's start first of all with the latest forced evacuation orders being issued for the Indonesia hospital. This is after, of course, what we saw a kind of similar pattern in Kamal Adwan, forced evacuation orders, and that place burnt to the ground. What is that doing for the humanitarian situation in the north of Gaza, where these hospitals are?
Well, it's leaving approximately 50,000 civilian Palestinians without any hospital health care at all, because Kamal Adwan, El Auda, and now the Indonesian hospitals are all destroyed by the Israeli occupation forces, which is, of course, a blatant violation of the Fourth Geneva Convention, which we happen to have the 75th anniversary of this year. So it is a disregard of all basic international humanitarian laws, and it is a colossal violation of any human standard of how we treat each other. For the people of northern Gaza, this is a disaster, because the people of North Gaza have been the most exposed to the siege for the last 80 days. So they are starving, they don't have water, and now they are denied even basic hospital service. And I would oppose
Dr. Mads, you're an expert in hypothermia, and we've had cases, I think 7 cases of babies dying. We've had cases of people suffering from the cold. Would the deaths of babies occur were it not for the destruction of medical facilities, were it not for what OCHA has termed the toughest restrictions on humanitarian movement ever recorded being imposed by Israel in December? Would those deaths have been preventable?
The most important way to prevent hypothermia death is to hinder that kids, sick women, and other humans become cold. They need warm clothes, shielding from precipitation, from rain and wind, and a house to live in. So you can't have even 100 hospitals prevent the mass hypothermia that Israeli occupation forces are exposing the Palestinian civilians to now, and in particular newborn, toddlers, and children, of course, because they very quickly lose the heat. The most important thing is to avoid starting cooling down by having dry clothes and good rain gears and a place to stay to shield from the bad weather. It's winter in Gaza now, and I fear that hundreds, if not thousands, will die from hypothermia, and it will also add complications to those who are already sick and wounded, because hypothermia will reduce your immune resistance, your resistance against bacteria, and it will deplete your energy. So it's not a matter of only hospitals, but it is a matter of the general protection of the civilian population. And when you are starving and when you are sick, you are extremely vulnerable to hypothermia. So this is part of the plan. This is part of the genocide. And, the Israeli medical authorities, they know everything about it. And you can only imagine if 2, let alone 4 or 100 Jewish children had died from hypothermia in Tel Aviv due to a man-made siege and an imposed starvation, the world would have been standing upside down. Or if the Russian forces in Ukraine had systematically besieged, starved, bombed, and burned Ukrainian hospitals, the European governments would not have been sitting quietly watching.
We've had the UN Special Rapporteur for the Palestinian territories call for medical professionals to cut ties with Israel. Is that the right thing to do?
Absolutely. I really commend her for this brave move. She's always been a very strong voice, and she's always referring to the existing international laws that we thought that we had an obligation to follow, any nation.
But Dr. Mads, what about the Hippocratic oath that doctors are supposed to take and be, removed from politics and, and to connect with people as humans?
But it's not politics to choose side of your patient. That's your obligation. And in our case, the patient is the civilian population in Gaza. And it is our historical duty to choose their side and stand up to defend them. And in that circumstances that we have now, the boycott, divestment, sanction movement is one of the few tools we have left. So totally agree to the move to boycott and to break all the connections with the Israeli medical system. I'm just about writing now to my own medical association in Norway to demand from them that they break the ties with the Israeli Medical Association. I think this can be a very important global move to stand in solidarity with our colleagues and with the patients of Gaza. That is in accordance with the Hippocratic Oath. To try to say that you're neutral or apolitical in this situation means to take the side of the occupiers and the oppressors.
The WHO Director General says it'll take 5 to 10 years just to evacuate all the critically ill patients in Gaza. When you start to process that, 5 to 10 years, what does that tell us about how desperate, how really wide scale the humanitarian suffering is?
Well, Sami, I think it tells us everything. And I think there are two ways to solve this, if it can be solved. One is to think of Gaza as a sort of a completely destroyed healthcare system, and everybody has to go outside. It's right that there are about 25,000 needing patients with cancer, with diabetes, needing renal transplantation or dialysis, and with cardiovascular diseases. And they need medical treatment. But the most important way to assure that the people of Gaza can have medical treatment is to repair, reopen, and restore the Palestinian healthcare in Gaza. Most of the hospitals can quite easily get into function. They're not all bombed out like Shifa. And the only thing that it can really make sure that the Palestinian people in Gaza have a healthcare is to restore and respect the Palestinian governance of their healthcare system, and to lift the siege of Gaza, and of course to have an immediate ceasefire. What we are seeing now, we have seen so many times before. Right before a ceasefire is implemented, the Israeli forces increase their attacks, increase their killings, and increase the attack on healthcare. And that's precisely what we're seeing in North Gaza, where they obviously want to have absolutely no healthcare on the hospital side in order to conquer and to annihilate the North Gaza territory as part of Israel.
All right. Thank you so much for sharing your perspective with us, Dr. Mads Gilbert there.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.